Welcome to Networking Arizona with host Carol Blonder. You'll hear interviews with businesses located throughout the valley. Networking, it makes a difference. If I
So welcome to the show, everyone. And as all of you know, I made it possible for people to talk about themselves right on the air. Who doesn't like talking about themselves? If you want to get yourself heard on the show, just give us a call here at the station at 602-277-5369. They'll get you connected with me, and we'll get you on Networking Arizona. I'm going to go with my first guest, who I'm excited about having on. He's got some great news to talk to us a little bit about. I have with me Lynn Marble, and he is the owner of Phoenix Health and Life Insurance. Welcome to the show. Tell everybody a little bit about yourself, what you do, kind of know a little bit, but tell us about yourself and what's it kind of going to be going on. And it's a very good time to be coming on the air and talking about what you do. Go ahead.
Yeah, Carol,
right into that mic.
You bet. So, my name is Lynn Marble. Phoenix Health and Life Insurance is our agency. We're a family, local health and life agency. We specialize in all things that are individual health plans, for group health plans, and for our Medicare beneficiaries.
Okay. Well, there's a lot going on for the election year. Everybody's getting crazy about it. And so tell everybody what people can expect with the individual market for 2017.
Sure. This is something that a lot of people are going to really start talking about. In about 90 days or so, we're expecting to lose about 156,000 clients across the state of Arizona. Are going to be losing their health plan. So this is important. I think that people here in Maricopa County need to know that their choices have drastically diminished. We've got health plans like Blue Cross Blue Shield, United Healthcare, Humana, Assurant, Meritus, Phoenix Health Plan, Health Choice. All these plans have withdrawn. We're going to be left with 1, 2, possibly 3 carriers, small HMO networks. And we're looking at drastic price increases. So we're looking at price increases anywhere from 47 to 85%.
Well, listen, I don't know whether or not it's just started happening,
Correct.
But it happened to me.
Yep.
Already.
Yep.
This happened last year, and I had health insurance, and they went out of the health insurance business. You know, they just said, we're not going to do it anymore.
Right.
So tell everybody what they need to do, because it's very scary, because, yes, they went up like astronomically to the point where, people really would say, I can't afford that.
Sure, absolutely. We're telling our clients, hey, unfortunately, this is happening faster than we expected. And we in the industry knew that this, being the ACA or Obamacare, was not going to be a successful endeavor, and that it was most likely going to fail. We didn't expect it to fail this quickly, so even to us, this was a surprise. But when you have carriers losing $100 million plus per year, you can't blame them. They're going to pull out. The Obamacare laws can tell them how they have to sell their plans and what needs to be in them, but they can't tell them they have to offer coverage. And that's exactly the extreme measures that they've had to go to.
So the individual gets hurt.
Correct. Yeah.
Right. So here's what we're going to do. We want to open up the lines. I know you have something special that you want to offer. It's informational more than anything, but it's something that you want to talk about. What do you recommend for these people?
You bet. So we've got a couple of strategies. November 1st is when the rates for the few remaining carriers are going to come out, and there are going to be a lot of shock and awe at that point. That's when people are really going to wake up and say, whoa, what is going on? We've taken extreme rate increases year over year. This year is going to be beyond ridiculous. We expect the only people that are really going to be participating in the on or off exchange market are going to be those people who are significantly saddled with pre-existing conditions, and or those people who are getting significant subsidies. So the income threshold that's just above Medicaid, that is getting lots of help from the federal tax dollars. Everybody else is going to be paying for those subsidies.
Now, you're going to be giving away, this is cool, guys, because it's informational, but you're going to want it, especially if you think that, not if you think, you won't even know until they tell you, right?
Right.
Well, so you're really going to want this information. I'm going to open the lines up to the audience for this. It's an informational packet for an Obamacare alternative for 2017. You're the only one, practically, you think you're one of the only agencies in the state of Arizona that's even going to offer this. So this is important. Listen up. It's a medical health share plan, a share program, okay?
Yep.
And you want to hear about this, so our lines are open. We're going to give everyone a little chance to hear about it from him, a little bit more about it, and everyone can call in and get it from us. Our number here is 602-277-5369, and toll-free it's 1-866-536-1100. So let's talk about this plan.
You bet. So we've got a company out of Austin, Texas. They're a 501(c)(3). They've been in business prior to December of 1999. This is important because it grants them CMS exemption or exemption from the Obamacare penalty, which is really important. That's going to allow members of this medical health share program called Altrua Health Share Ministries to be able to file a tax form every year and tell the IRS to take a hike. Okay, they're not going to be penalized. That's one of the obvious, benefits. The other nice thing about this is it allows people to get away from this restrictive HMO model that they've been forced into and be able to go back to a large nationwide PPO network that includes Mayo Clinic, includes Banner and Honor Health and Dignity and all of the healthcare systems, major healthcare systems here in the Valley in the state of Arizona. It's also going to allow people to secure $1 million of coverage, to get doctor's visits, first dollar covered. And it also, because it's not governed by the ACA rules, it's going to allow people to enroll when they want throughout the year. We can do this here in Arizona, or the prices are the same in every state across the country.
Is it affordable?
It's absolutely affordable.
That's what we want to know. I mean, we want to know whether or not we can see our own doctors,
right? And
if we have to have catastrophic,
it is. Yeah. So let me give you an example. So here's a gold plan with Altrua Health Share. It's basically a $500. We can't call it a deductible. We call it a member responsibility amount. And that $500 plan is for a family whose head of household is under 39 years of age. For a whole family, it's $480 a month.
Wow, that for a whole family.
For a whole family.
Okay, there we go. So here's what we're going to do. We've got our lines open here for everyone to get this information. It's an alternative for the Obamacare for 2017, and they're one of the only agencies in the state of Arizona that's offering it. So 602-277-5369, toll free. It's 1-866-536-1100. Your services alone are free.
Correct.
You don't charge.
We actually get paid from the carriers when we enroll somebody, and therefore there's no need for us to charge anything. One thing that I want the public to understand, though, is that these 2017 Obamacare plans, unfortunately, will not pay broker's commission this year.
Okay.
We just got announced 0% commission. So not only are we in a time, in a crisis, where prices are through the roof and people need help more than ever before, but now they have simply said, hey, we're not going to pay you anymore, so any professional advice you've ever received in the past, that's going to be pretty much gone.
Wow.
We're going to continue to help our customers and clients out of loyalty and to do the right thing, because it's the right thing to do. But we have come up with a couple additional strategies to help move our people in the right direction.
Now, do you do free consultations with people?
We do.
Right. Everything you do is free, really?
Correct.
Okay. What's your phone number for them to call?
You bet. 623-516-8300.
Okay. And your website is Phoenix, which is spelled PHX, Health Insurance, and that's all spelled out, .com. And we've got our lines open. We're going to let everyone call out throughout the rest of the show for this. It's it's an alternative to Obamacare for 2017. It's an informational packet only. There's no obligations for anything about this. Everything he does for you is free. It's a medical health share program, and our number here is 602-277-5369. Toll free, it's 1-866-536-1100. And again, they're one of the only agencies in the state of Arizona that's offering this plan. Okay, so let's talk a little bit more about it. Is it like a membership type of thing? How does it work?
Great. So what it is a 501(c), not-for-profit. Think of it as a pool of like-minded folks who have the same moral compass, who believe in leading a healthy lifestyle, and because of that, they are all sharing each other's medical needs. The nice thing about this is are they going to exclude you if you're 10 or 15 pounds overweight? Absolutely not. It's very height weight lenient. Now, is it guaranteed issue? No, it's not guaranteed issue. This is not going to be for somebody who's 390 pounds and has diabetes and needs a liver transplant next month. This is not going to work for them. But for the family who has the occasional doctor's visits, the minor chronic situations, this can be a great alternative.
Well, the only way you're going to know is unless you find out. Mm-hmm. You can do a free consultation with him. Everything he does is free. You can call him at 623-516-8300. The website is PHX Health Insurance is all spelled out .com. Our lines are open here, and I'm going to let everyone call throughout the rest of the show for this informational packet. It's information for you, and that's all it is. And it's an alternative for you. Our number here is 602-277-5369.